Good morning, all. My name is Okechukwu Iwiju, and today for my question one is impact of familiarity with cultural competence, terminology, and basis in patient care. As I read through the article, I wish my educational program gave me more. My familiarity with the words used in the study is moderate. For instance, concepts such as implicit bias, cultural competence, inclusion, and access may be heard and used relevantly and routinely in the health and social science. More than 74.5% of the participants reported familiarity with these terms. This shows that kinesiology students are reasonably aware of these essential concepts. The first thing that comes to mind when I encounter these terms is positive sense. They refer to the crucial factors for constructing equal, efficient educational and working environments. For example, when people hear cultural competence, they automatically think of diversity in patient care. Implicit bias, to contrary, can seem quite alarming. It makes me think of the psychological pres- prescript of prejudice that one may witness deep within but still influence when making decisions or actions. These impressions might interfere with my biases while attending to patients. Learning terms like implicit bias and can help me realize I need to be more careful in my actions, as I do not want to discriminate against candidates unwillingly. Despite the high response rate indicating that students knew the terms, more than half stated that they only received rarely or occasionally instructions in their classes. This gap implies that even though I might acknowledge the significance of these terms, I need more educational support to enhance my real-life appreciation and implementation. For instance, students whose opinions were captured in the study reported moderate self-confidence while working with the unique population whose scores fell between 6.0 and 7.4 on a scale of 1 to 10. This moderate confidence indicates that even though students understand the topic of cultural competence, inclusion, and diversity, they may need more preparation to deal with issues related to those groups upon completing their training. Thus, this opinion is closer to mine because first acquaintance with some concepts does not necessarily signify further mastery. These terms influenced my first impressions of patients and thus affected my biases in their care. When I relate cultural competence to positive active behavior and practice, I can embrace learning and practicing cultural sensitivity. On the other hand, if I perceive implicit biases as something negative or that cannot be changed, it may affect my behavior with the patient. The study's qualitative data, where students completed questionnaires with hypothetical case studies of special populations, revealed that existing training needed to be improved. Some students admitted they were not well equipped to deal with com- conflict-based scenarios or intervene, indicating the need for more profound curriculum changes. According to Powell et al., students d- delineated that they learn much of the content they need to feel comfortable working with special populations in PA settings. From kinesiology courses, this standpoint underscores the need to introduce and uphold social justice education within kinesiology. They concur with the study's assertion that subsequent providers should be trained to detect prejudice to bring about change in favor of a diverse culture. It would be my first impression about the terms that dictate how I handle them in my practice situations. For instance, whether to seek more training to enhance my competence level. In conclusion, regarding the terms used in the study, my first impression showed me how much I need to learn and, more significantly, apply them to practice. Due to these findings, the study emphasizes that knowledge of such framework alone cannot eradicate prejudice and improve service delivery. Knowing and handling the feeling that I initially have before addressing a patient helps me prevent the bias from affecting my practice. And this is my reference.